So I'm here on the couch at the National Rural Health Conference 2016 with Dr. Tim Malloy, college president and farmer. And Tim's recently returned to the role of president, or are you in transition, having been off for a considerable period of time after a significant accident. Can you tell us something of that story, Tim?
Sure. I manage a hill country farm about an hour north of Auckland, which I own, and I run about 100 breeding cows and their offspring, and about 1,000 breeding ewes. And I was on January 26th of this year mustering my Romney hoggets in my paddock, and I was after a ram that had actually escaped, and went down into the paddock in a quite leisurely manner, but unfortunately there was a ditch which I made a judgment about, and unfortunately, even at a very slow speed, I managed to get my judgment incorrect, and as I turned to avoid the ditch, the wheel of the bike dropped slightly into the ditch, which caused me to do a forward roll, throwing me off the bike, and I landed on the bottom of the ditch, and the bike slowly rolled on top of me.
Right.
Where it pinned me down for the next 4.5 hours until I was finally found. I then spent 2 weeks in intensive care at Auckland Hospital with major chest injuries, collapsed lung, a burn on the side of my abdomen, and damage to the nerve supply to my left leg and to the muscles of my left leg, which I'm slowly recovering from. I had to have dialysis for a period of time. I had to have respiratory support and intensive care, and they managed to stick a tube into just about every orifice you can imagine.
Yes, very good.
As the hospital healthcare professionals like to do.
Yep.
And finally I'm now in the process of recovery. Although I don't think recovery will be complete. I'm hoping it'll be as complete as possible.
Yeah. So you've experienced the healthcare system from the consumer's perspective in a very intensive way.
Absolutely. One of the consultants said to me, Tim, if you wanted to come and visit us, all you had to do was ask.
Do you have any reflections on that experience as a rural GP, going into needing the highly intensive therapy from the specialists?
There's absolutely no doubt that that kind of level of intensive care is something to be avoided if you can possibly do so.
Yeah.
But knowing full well that the quality of care that these people could offer me, and the standard, the expertise, the intensity of it all is incredibly reassuring, because without that I wouldn't be alive.
Yes.
Quite simply. And I think as a backstop to the work that we do, for example, it's actually really great to know that there is this expertise there that we can tap into when or if we need it.
Yeah.
And ideally we don't make the silly decisions that I made, which mean that we do need it.
Yeah. But as a prime provider in that area, it must have been very scary for you waiting for those 4 hours.
It was a series of both thoughts and emotions which were mostly driven by the fact that I could hardly breathe.
Yes.
That were the basis of my thinking at the time. There was nothing about it that was pleasant.
No.
At all. It was very frightening.
Quad bike injuries happen not infrequently in New Zealand. 850 people a year are injured in quad bike injuries. 5 of them die, and it sounds like you were very lucky not to be one of those statistics. You must have done quite a lot of thinking about the quad bike and these the initiatives that are in place to try and promote safety using these tools on a farm.
So I've been involved in farming since I was 18. And in the early days I started, which is nearly 40 odd years ago now, we began with the early equivalent of a quad bike, which is actually a trike.
Yes.
And So for many years, I don't know if you know anything about trikes, but you think quad bikes are dangerous. Trikes were incredibly dangerous, and they flipped over almost daily sometimes. And then we moved to quad bikes, and things improved significantly. But one of the things that's an absolute must on a hill country farm is that this is an essential part of the equipment of the way we do business, and of all the tasks that we do. It would be used daily, continuously. So it's a critical element of managing what is now a relatively big farm, 1,250 acres of hill country. And really I can't do it without this kind of equipment. So upon reflection, a number of things that we'd done already before this incident, I had decided that in fact a roll bar was an essential, and so on my fleet of bikes I had arranged to have roll bars on all of the bikes. We had safety helmets, and it's a policy of the farm that everybody wears their safety helmets, although I'm not so sure that that would have made any significant difference in a number of circumstances. There will be other circumstances in which it might well have done so. What's clear to me though is that with this statistics, for example, this is not enough. There is something about the way we use our equipment, and we have to use our equipment in New Zealand, with which we need to do a great deal more thinking, and we need to be seriously more innovative in the way we look at safety. These measures that we know about already are one thing, but accidents are happening even with these measures. And so what I'm thinking is that we need to start exploring alternatives. Is the wheelbase adequate? Are the wheels themselves, the size of the wheels, adequate? Are the tyres the right tyres for the vehicle? Is there anything about the design and way we set up our bikes that we could do differently, which make them less likely to roll? Can we eliminate mistakes altogether? In my scenario, my personal rule was that I would navigate each paddock for the hazards before I would muster in them. I broke my own rule, and I paid nearly the ultimate price. So stupidity is something you can't regulate or design against, but there are other aspects of these particular statistics that you could do something more about. And in my view, we need to take this very, very seriously. To suggest that we shouldn't have quad bikes is not good enough. They are an incredibly important part of the way we do our farming business nowadays. And therefore it's just a nonsense to say don't have them. In some farms, the side-by-sides will take over the role of the quad bike, and yet to be determined, may have a better safety record. But at the end of the day, there will be many farms in which a quad bike is an essential part of the way we farm. And it's important, therefore, that we find ways to ensure that the design is as safe as we possibly can. And I don't think that we've explored enough of those options yet.
It often happens in rural communities that people under the radar, or they will adapt things in ways that they think might work, and just that they adapt their tools to the context that they work in. And I'm sure there are ways that you heard, or of people adapting their bikes to try and make them safer.
While I'm not recommending any of these because I don't know enough about it, I've been contacted by two separate people since the accident, both with a medical connection. One has modified his quad bike to have double wheels on the rear, on both sides. So he's had an engineer alter the axle and double up which gives him a seriously wider wheelbase at the rear. And another one has been using an old technique that we often use in tractors and farming, which is to put water inside the wheels, and it keeps the feet on the ground kind of concept. Now, what I would like to see is some sort of evaluation or a research process around ideas like those, for example, and there are probably a great deal more out there to say, is there a better way that we can do this? Is there a safer way that we can do this? And start looking at more from a straight design perspective.
I know WorkSafe New Zealand have a website. They offer advice about how to help to protect, and they suggest wearing helmets, keeping children away from adults, adult quad bikes, choosing the right tool for the job, and it's about being competent to drive as well. So does that have a facility for suggestions like this in terms of, and is there a current move for further research into quad bike safety that you're aware of?
I'm not aware of such a move. What I am aware of is the resistance on the part of the manufacturers to actually want to modify their original product for mostly, in my view, legal reasons, which are about protecting themselves. I don't know that that's good enough, in the sense that I think the way we use the vehicles in New Zealand may well be quite different from the ways in which it's used elsewhere in the world. And in that sense, I suspect that needs to be a research base that is New Zealandized. Now, does WorkSafe have such a process? I simply don't know.
They have an important question that I wanted to ask, which is how is the RAM?
The RAM is with the ewes that he should be with now.
Right, that's very good. That's very good.
Thank you. Absolutely.
Was there anything else that you wanted to say, Tim?
One of the things that concerns me with our predisposition towards accidents is the fact that, as in my experience, it was really difficult for me to be found and therefore helped. I, like many farms in this country, am cellular dead. Even if I had a cell phone on me, I couldn't have used it. I had no other means. I'm aware of emergency locator beacons, but I hadn't pursued that option, and I'm beginning to think that we need to be looking along these lines. What I am looking to explore automatic ways to activate these, because I know that I would have been disabled and wouldn't be able to activate them. So I'm exploring the way that we might design the response to events like these more effectively, and using technology solutions to what is clearly a scenario in which human beings can't necessarily make a lot of difference.
Yeah. So those cellular black spots, which are all around rural New Zealand, until the event happens that really points out that they really need it, we often just sort of feel them as minor frustrations, but we really need to see something more done about that.
Especially in terms of helicopter retrieval and things like that, it clearly matters.
Well, thank you, Tim, for sharing your story. I know it's very raw for you, and thank you very much.
Pleasure.